The crime is a threat to the society, the growth of the society, the harmony, the peace of the society, as well as the country. And we all have to stop this one. How we can do is by preventing the crime happening. This is one situation. The second, when the crime has already committed by a person, we have to do that he cannot or he won't do a further crime in future. That is by helping the judiciary to convict that particular person for his act. This can be done by doing a proper investigation of the crime which that particular person has committed. So the police, the forensic science experts, the doctors, mainly the forensic medicine experts, okay, and other people of the they either directly or indirectly are involved in the crime investigation. So they have a different role to play in the crime investigation. Okay, so the topic of today's session is to brief you regarding the role of medicine or role of medical knowledge or role of forensic medicine crime investigation. The outline of today's presentation will be, I will be discussing regarding some of the terminologies, mainly the forensic medicine. So we'll be discussing few case examples that are done by me and the role of forensic medicine in crime investigation, okay, where all the medical knowledge will help in the investigation of a crime. As ma'am said, the forensic science, it's a broad division. All of you know this one. So it consists of people from various divisions, the ballistics, the chemical, the toxicology, fingerprint, others. Okay? So I just included this slide because the students should know that the forensic medicine is different from forensic science. We have seen in many forums people addressing the forensic medicine as a forensic science. Forensic science is a broad division, okay, where the scientific knowledge is applied to aid in the administration of justice. Whereas forensic medicine, it is the application of the medical knowledge. So whatever the medical knowledge our doctor has gained during the course of MBBS and MD, he applies that medical knowledge to help or to aid in the administration of the justice. So there is a definition of forensic medicine. So forensic medicine is a part of a forensic science, but it is not the forensic science. Going to the brief history regarding the forensic medicine. So the term forensic medicine, it said that it has derived from the Latin term, the forensis, the meaning of or before the forum. So earlier days in the Rome, the disputes were tried in front of the respectable persons of that particular society. Like in India, you might have heard the panchayat. So panchayat, where the small issues or small disputes in the villages are heard by the panchas or the respectable persons of that particular village or the society. Okay? So by definition, it's the application of medical knowledge to help in the administration of the justice. In other words, the medical aspects of law. So it's not that the doctor should have only the medical knowledge. Okay. So here in the forensic medicine, so we apply our medical knowledge to help the law. In other words, it's a medical aspects of law. So the case which I could not show you to you was regarding a case of electrocution. Okay? Worker or the laborer was found dead, okay, outside one of the shed, okay, where he was living. Okay? And it was a rainy day, and all his colleagues brought him to the emergency department of our hospital. And I think someone might have given an idea to them saying that to give a history of lightning so that they'll get a compensation from the government. Okay? And they give a history of lightning. And on postmortem examination, there were no features suggestive of lightning. There were no features suggestive of lightning, but there were features suggestive of electrocution, contact with the electricity and death due to the electrocution. Okay. In that particular case, we kept the part of the skin where we found a entry mark or the entry of the electricity and all the organs for the pathological examination. Pathology is another department in the medical college, okay, where they examine all the organs microscopically. And the pathologists, they give a report that that injury is consistent with the electrical injury. That's the entry of electrical current. Okay. So here the indirectly it helped in the investigation, saying that it is not because of the death is not because of the lightning. Okay? It is because of the electrocution. Okay. There was a faulty electrical wire at the shed, okay, where he was staying, and indirectly this goes against the person or the owner or the employer, okay, who is supposed to provide the proper what the conditions, okay, or the that electrical this one. So because of his negligence, this person came into contact with that live wire. Okay. So the autopsy along with the pathological examination, it has totally changed the type of the case from a lightning. Okay. It's like a natural, not a natural death, death due to the natural calamity, to the negligence by a employer. Okay. The other the areas where we help the police is in case of thermal deaths. Okay. The main thing is a dowry death. Okay. The based on the distribution of the burns, we can comment whether it's accidental, suicidal, and homicidal. But it's a very difficult. Okay, if the entire body is burnt, it is very difficult to comment. But to some extent, but not definitely, we can say whether it's a the suicidal, accidental, or homicidal. Okay, so like injury, the burns also we can comment whether it's the antemortem or the postmortem. Okay, so if the body is burnt after killing by some other way, okay, so we can say whether that burns was an antemortem or postmortem. Okay, but regarding the manner, it's a slightly difficult in thermal deaths to comment whether it's an suicidal, accidental, or homicidal. The asphyxial deaths. Okay, so there are various type of asphyxial deaths. You are aware of the different types. The main two are the hanging and the strangulation. By their face value, the hanging goes in favor of a suicidal, whereas the strangulation goes in favor of a homicidal. But hanging could be a homicidal or accidental. Okay, but strangulation is a rarely suicidal. Most of the time, it will be homicidal. So based on the ligature mark, okay, based on the distribution of the ligature mark, we can comment or we do comment regarding the manner. Okay, we do comment regarding the manner. So one simple example in case of hanging, the typical or the classical hanging, the ligature mark will be discontinuous. It won't be present around the entire circumference of the neck, okay, and it will be oblique. Okay. Whereas in the strangulation, the ligature strangulation, it will be complete and it will be transverse. Okay, these are not the only points which help, which make us to differentiate from suicidal and the homicidal, or the hanging and the strangulation. There are other points we consider while commenting, okay, regarding the type of the death, okay, whether it's a hanging or strangulation, or in hanging, whether it's a suicidal, accidental, or homicidal. Okay, we do comment based on the ligature mark, whether it's an antemortem or postmortem. So the sexual offenses is another very important division where only the or the important evidence will be the medical evidence. Okay, so in other crimes, so the have other evidences which help in the investigation, whereas or the convicting the accused. Whereas in the sexual offenses, the medical evidence play very important role in convicting the accused. Okay, so the doctor's role in the sexual offenses is examination and preserve the collection of the proper evidences. Unless we collect the proper evidences, those evidences cannot be analyzed properly in the forensic science laboratory. Though they are analyzed by the FSL people, but the proper collection, the early collection, the collection of the samples from a proper site is very important, and that is the role of the doctors in sexual offenses. The infanticide, okay, the infanticide or the infant death, okay, you might have heard the term the battered baby syndrome. So it's a case of killing a baby. Okay, the infant is a term that is used for a newborn till the age of 1 year. Okay, so infants may die due to the natural cause or due to the accidental cause or maybe killed. Okay, so the when infant's body is brought for the examination, okay, the relatives, if it is a case of infanticide, they may give a history of the natural death. Okay, so to avoid the conviction and other things. Okay, so if it is a case of natural death, we have to think in another angle also. Okay, so though it's a case of natural death, though the relatives or the parents give a history of natural death, but while doing the autopsy, we have to keep in mind the possibility of unnatural death also. That's a possibility of homicide. Okay, by examination, the medical examination, like in an adult, we do help in commenting, or we do help the police in commenting whether the death was due to the natural disease or due to the unnatural cause. The poisoning, so especially the snake. Okay, so you know the poisonous snakes or the venom of the poisonous snakes are misused for killing the individual. So many cases are reported even in our state, in the Karnataka, where the venom of or the poison of snake was used to kill the individuals. Okay, so based on the examination, okay, the injection site and other examination, we do help in finding out whether is it a real case of snake bite or it's the use of the venom, okay, by another individual for killing the victim. Okay, the poisoning case, the medical examination in dead individual, the collected blood and viscera and the postmortem findings will also help the police in finding out the or in investigating the case. Okay, the new branch, the emerging branch, it's already emerged, but it's not established in most of the medical colleges. Okay, it's a unit of clinical forensic medicine. Okay, which mainly deal with the crimes related to the sexual or the crimes like sexual offenses, the assault, okay, or the offenses. It's a type of sexual offenses under POCSO Act. Okay, and these are the recent branch, okay, the emerging branch in the forensic medicine. There is a clinical forensic medicine. Just to conclude here, what I want to convey that the knowledge of medicine do help in the investigation of a crime. It is not always the analysis of the evidences and other things. Even the medical knowledge, okay, do help in the investigation of crime. It has to be applied properly, so then only it will help in the investigation of a crime. And the doctors, especially the forensic medicine experts, can also be a part of crime scene investigation team. Most of the time, we are not included in the crime investigation team. We are made to restrict only to the medical examination and to give opinion based on the examination of the victim, or to give opinion after the postmortem examination. What I personally feel that we can also be included as a member of an investigation team. So most of the time, the investigative officers, the forensic science individuals, they form the members of the crime investigation team. So this is what I want to conclude from this session. Okay. Just the final thing, as I told earlier to the students, the forensic medicine is different from forensic science. Forensic medicine, we doctors, we apply the medical knowledge, okay, what we have gained during MBBS and MD. Okay, we also help in the investigation of a crime. Okay, and we can also be included as a part of a crime investigation team.